Hello, you're watching Health Day Now. I'm Mabel Jong. After the CDC gave the green light for kids ages 12 to 15 to receive the Pfizer COVID vaccine, thousands of students across the country have gotten their first shot. But some kids and their parents still need reassurance that these vaccines are safe. I'm pleased to have Dr. Hina Talib here from the Children's Hospital at Montefiore, also a spokesperson for the American Academy of Pediatrics. She's going to address the most common concerns. And also Alan Santee, a high school freshman from Drake, Massachusetts, on why he didn't hesitate. So great to have the both of you here.
Thank you.
Thank you.
Well, Dr. Talib, let's start with you. You have an Instagram following of over 30,000. You've heard from a lot of parents, not necessarily anti-vaxxers, but certainly vaccine hesitant. What kind of concerns are they sharing with you?
You know, parents naturally worry more about their children than they do themselves. I think that's parenting defined. And their concerns, unique to teens and tweens, have been about safety and about puberty, about development, about things that sort of uniquely are in front of them in terms of a lot of their kids have been home and going through puberty. So I think that was reflected in some of the big buckets of questions that we were getting.
Yeah, sure. I get that. I'm a mom. I certainly feel what they're feeling. But let's get to some of the most concerning issues circulating online. For instance, parents feel they just don't have enough data, not enough long-term data. What do you think?
So I think that is a common concern, and rest assured that there were no shortcuts taken in how these trials were conducted, and by such, we're just so happy that we were able to see such efficacy. They actually work even better in tweens and teens than they do in adults, and so it's wonderful news. There were no shortcuts, and we can feel good that there is good data to support that this is a safe option. The other thing to remember is that vaccine side effects typically happen within 6 weeks. So we have enough data to cover that time frame. You know, it may be hard to know long-term, impossible to know right now the long-term, 30 years from now questions, but we have to focus on what the concerns would actually be, whether they're biologically plausible even. And we can look at the history of all the other vaccines. And so we get a little bit of comfort from looking at all of the other vaccines that we've had and knowing that, again, most of the side effects when they arise come quicker and within the time frame that we've actually looked at them.
Okay, so regarding the side effects, maybe some parents feel that their kids are bulletproof. Why not just get the virus instead of taking the chance with the vaccines?
So many children have had the virus, with 3.9 million children have had COVID-19 infection, and thousands have been hospitalized and hundreds have died. And I think that children and teens should not be an afterthought. I think their health matters. And so I know that a lot of people will say, hey, but the risk is low. And while that is true, it does not mean no risk. And once again, as a health advocate, if we have, and we do, a safe and effective option to treat, to prevent this infection, by all means, I encourage my patients and the teens that I know in my life who are more recently eligible to go ahead and accept this vaccine.
Okay, maybe it has something to do with the name of the technology that the vaccines are built from. Some parents think that COVID vaccines work by altering DNA.
Yeah, I've heard that too, and I think it's important that and when they say that, they're often anxious and worried about it, and but we have to look at the science and not science fiction. And so these vaccines really they do not enter the cell's nucleus, they do not alter DNA, and they will not alter the DNA of future children. I've heard that question as well. It's actually like a code, much like a Snapchat. It just sort of comes in, it does its job, and then it disappears out of your body within a couple of days. So it doesn't alter anything, and it doesn't stay with you for this life and for future generations.
Mm-hmm. Now, parents are really worried that they're putting their kids' fertility at risk.
Yeah, that is a big one that I've heard as well. And vaccines do not cause infertility. We know that looking at sort of all the other vaccines that we've had at play. And there's no biological mechanism that this would actually come to pass and be a side effect that, or a long-term effect that we need to worry about. But I understand why parents are asking this question. You know, you look at your teen and your tween and you think about their whole life ahead of them. And I think about the whole life ahead of them in terms of, I want to protect them from getting COVID-19 infection, because we know that some of the effects can be long lasting. So, you know, here we have a vaccine for to prevent a condition that may actually be long lasting, that's actually happening right now and we're seeing it, versus the hypothetical and sort of not really biologically plausible myth really about fertility.
Right. Okay. I'm going to bring back Alan. Now, 15-year-old Alan Santee, you just got your first dose of the Pfizer vaccine, one of the first in your town. As soon as the vaccine was made available to you, you just went for it. Why? Are you getting vaccinated for yourself, for your community, or both?
I believe that getting my vaccine is definitely going to help, take care of this whole pandemic and get rid of it.
Okay, so you were able to get a lot of information from what you were studying. Now, what are you hearing from some of your classmates? Are there some reasons that perhaps they're saying, out loud that they don't want to get the shot, and why?
It's actually, I started to notice it. It's like maybe 70-30, like 30%, they don't want the vaccine. It just sort of aggravates me when, I see my friends who just don't want the vaccine because they just don't care. They don't feel like COVID is going to harm them.
Right. Dr. Talib, Alan brought up an interesting point. Are kids the challenge here when it comes to not wanting to be vaccinated, or is it the parents and what they're saying at home?
You know, I see both sides of it, and I speak to adolescents, young adults, and parents, and sometimes together and sometimes separately. So I will say that I see all sides of it. And what's important is that we help everybody communicate. And so I'm going to offer up pediatricians to be your intermediaries. And, if you're having a hard time having a conversation, whether it's you as a teenager or you as a parent, because there's a disagreement, please come speak with us and let us help be the intermediary and help you guys have a family conversation about it. And of course, we can add in evidence-based information. We can teach you about the trials. I love how much you've learned about science and about the trials yourself. And I think that actually really does help folks, is to really understand how this vaccine came to be.
Right. Yeah, that's terrific. Now, Dr. Talib, are you encouraged at the rate of vaccination right now, or do you think we need to go faster?
I'm an optimist. I am encouraged, and I do think that we have to keep sharing stories and keep sharing information to keep the energy up, because of course when it was announced, there was a lot of energy and uptake quickly. So it remains to be seen how it'll carry through, but I think there's a big push to help adolescents access this vaccine before summer so that they can have a more normal-ish summer. So let's keep this push going.
Yeah, I hear you. And Alan, what are you looking forward to most after getting fully protected?
Well, I'm definitely hoping to, see relatives more often, once I'm fully protected. But I know that just me being fully protected isn't going to, stop, some of the regulations in some places. So if we could all get vaccinated and, put end to this, pandemic, at least in the US, we can all get back to doing our normal stuff.
Yeah, I hear you. Yeah, I'm looking forward to that too. Alan Santee finishing up his freshman year at Dracut High School in Massachusetts. Dr. Hina Talib of the Children's Hospital at Montefiore. Thank you to you both. What if you're a teenager eligible to get vaccinated for COVID, but your folks are against it, like really against it? 20-year-old Ethan Lindenberger of Norwalk, Ohio, knows exactly what that's like. Hey, Ethan, thanks for being here.
Thank you for having me. I'm glad I can be here.
When you turned 18, you went against your mom's wishes to become up to date with all of your vaccinations. Until then, you hadn't gotten a single shot. How did it become so important to you?
As I was growing up, I heard my mom talk openly about her beliefs that were very anti-vaccine. She believed vaccines caused autism and brain damage and weren't safe or beneficial to anyone. And so it really became important to me to get vaccinated and to educate myself when I started slowly seeing there was a large community in the scientific field and outside my house that believed vaccines were really important and that they were safe and they had a lot of good benefits. And so that difference in perspectives and the confusion and curiosity I had, seeing people disagree with my mom so fervently, that just caused me to ask the questions. And slowly, I discovered that vaccines were really, really important, and deeper knowledge led to me becoming more and more invested.
Now, where was your mom getting her information?
Before I was born, she had friends and people told her stories and told her to read specific books, and she became slowly anti-vaccine. I'd say she was more hesitant at that time, and she only got some vaccines for my siblings, and by the time I was born, I only had a polio vaccine. That was the only vaccine she got me, and after that, she was done. And so I was born in 2000, and so after that was where she really became anti-vax. And when Facebook was created a few years later, she got into specific communities that got her way more, I would say, escalated in her beliefs. And so it was rooted in a lot of personal friends and testimonies and books that were coming out at the time, but then it grew because of the internet.
Okay. Now, as we all know, a lot of kids are on the internet. They're getting a lot of different types of information from there. Is that going to be a problem for kids, that they're perhaps not getting the most accurate info and not from the right places?
It can be a concern that a lot of people are doing their research online. Statistically, we've seen that Gen Z and some younger generations have lower vaccination rates than we would like. And you could determine that's because of internet research being done. But there also could be other factors at play. It's hard to define why that's taking place statistically. And also, I would say on top of that, it's more concerning that people are doing online research when we don't provide good education going into that, because the internet has all types of information, good and bad. And so it's not as much the fault of the internet, but the fault of a lack of education, preparation in terms of how you handle it. It's like going out to the real world and interacting with strangers. There'll be good strangers and bad strangers. You got to know when to engage and when not to, and how you identify the tells and the signs of what's reliable and what might be dangerous. It doesn't mean that it's bad to go out and talk to strangers. It means you got to be careful.
Okay. You fought your battle before the pandemic. You fought that battle to get vaccinated. Now, kids who have lived through this pandemic have even more challenges, it seems. I mean, right now, only 9 states allow teenagers to get vaccines without parent permission.
Right.
So how should kids go about finding out and discussing with their parents, having that conversation about getting vaccinated?
The advice I give to young people is, if you know you can have a loving and understanding conversation with your parents, please do that. And try and have that conversation and vocalize why you want to get vaccinated, your concerns about your own health and safety. But if you say that and you are worried about serious consequences, your parents not trusting you, your parents taking away your phone or kicking you out, like those are serious concerns for some young people, then maybe wait and weigh those consequences seriously. It's not as easy to just go get vaccinated and deal with it later.
Sure. And is this the approach that you've taken with your own mother?
Absolutely. I knew growing up that my mom was very anti-vaccine, and because of the legal restrictions, I really wasn't trying to fight her on getting me vaccinated. She believed vaccines could kill me, and so it was not going to be an easy time being like, hey, I want to do this thing and go basically jump off a cliff and see if I survive. And I just was educating myself slowly, and when I was 18, I said, hey, this is my decision now, but I'm still going to communicate it. I'm not going to hide it from you. I want you to understand where I'm coming from. And she still didn't respond great, but the fundamental reason I was talking to her in the first place and saying what I thought was out of respect. And I think that's important regardless of if you're able to consent to it or not. I think regardless if you're 16 or 22, if you still live with your parents and they're anti-vaccine, I would prefer having that conversation, recommend not hiding it and being open and honest.
Yeah. So any chance in convincing her to get the COVID vaccine?
No. My mom is very anti-vaccine. And I mean like the 1% of the 1% that are so deeply ingrained that it's not even just the anti-vaccine conspiracies, but the anti-mask, anti-science conspiracy theories, holistic medicine, the whole bunch. And that's not uncommon. It's just that like people that are so deeply down that rabbit hole find other rabbit holes. And for her, it's just that it's progressed that much. So I don't look at her as like almost recruitable to reality in a way of like trying to have that conversation and convince her she's wrong. I just understand she believes that. I understand that what I believe is right, and I try and bridge that gap with respect and love. But my time and energy is spent into talking to people that are hesitant, people that are asking questions rather than saying they know what's true. And
Yeah.
I think that's more productive.
So, and her reaction to you, the two of you being so far apart on this issue, you're a vaccine advocate now.
Right. It would be a lie to say that my advocacy has not impacted our relationship, because at some level, what she views my advocacy as is very different than what's really happening. She views my advocacy as the advocacy of young people being maimed and injured and murdered, right? People that are going and vaccinated and having serious consequences and repercussions. And because of how deep she is in this misinformation and that perspective, it definitely does warp her view of me as a person, because what kind of person advocates for young people to die and become injured? That's a pretty bad thing to do. And obviously it's not happening. And I know that, so I'm able to remain empathetic, but the impact is still there. And it's obviously caused a divide. And do we talk as much? No. Do we have the same type of relationship? Absolutely not. And do I see her as often? I don't. And there's been some huge changes. And that's the reality of the anti-vaccine world, is that it damages families, it damages communities, and it hurts people.
All right, Ethan Lindenberger, it's so great to speak with you today. Thanks for sharing.
Of course, thank you for having me.
Thanks so much for watching. This is Health Day Now. I'm Mabel Jong.